Now we're going to discuss behavior therapies. Behavior therapies are based on learning theory, on conditioning. We're going to look at three kinds of learning theories: classical conditioning, Pavlov; operant conditioning, Skinner; and observational learning by Bandura, and show how therapies can be based on these different ways of looking at learning. First, behavior therapies are a much shorter duration than most psychotherapies, so that's why they're very popular to be used. In this case, where in most psychotherapies you're looking at treating the cause of the symptoms, behavior therapy is very clear. They're treating the symptoms. That's what you notice. They're the things that are abnormal. And so if we do away with the symptoms, haven't we done away with the disorder? So the whole notion of behavior therapy is very different from the root characteristics of most psychotherapies. In classical conditioning, you have two kinds of therapies that are used: systematic desensitization, developed by Volpe, and aversion therapy, and we'll look at both of these. First, in systematic desensitization, I mentioned Volpe was the psychologist that developed this technique. You learn how to relax. A lot of instruction is there in how you relax, you remove tension. You sort of, like it's almost like a meditating kind of state where you're sitting there and you learn to be relaxed, to breathe a different way, to have reduced muscle tension, and you learn these relaxation techniques. That's a very important thing. Then you develop a desensitization hierarchy. Let's say you have a phobia against snakes, for example. Then you want to develop what is the least anxiety-producing characteristic that might be a snake, and it might be holding a piece of rope or something. Then it might be just looking at a picture of a snake, and then it might be going to the zoo and walk through the snake exhibit, and then it might be actually seeing a snake in an aquarium right in front of you, and then it might be reaching down and touching the snake, and then it might be holding the snake. Anyway, you just develop a hierarchy from low anxiety about the stimulus to very high anxiety about the stimulus. And then you associate the relaxation with the lowest item on the hierarchy, holding a piece of rope and thinking it's a snake. It might be painted like a snake, but you know it's a rope. And then when you have developed complete relaxation with that stimulus, then you go to the next level in the hierarchy. So you sort of work up the list to reduce the anxiety by the stimulus next in line in your hierarchy. By the way, you can use virtual reality here. It works very well. So you actually are not really experiencing real things, but you're experiencing things virtually. That also will produce anxiety. Do you remember Snakes on a Plane, the movie? Well, that's pretty anxiety producing. And you can work with simple extinction exposure. You don't have to really do the sort of Volpe kind of technique. You can simply, I remember seeing one example where a 3-year-old was just literally scared to death of fuzzy things like a rabbit and even fuzzy stuffed animals. So they had what the therapist did was has the 3-year-old sitting in one part of the room, a large room, working on something. And then the therapist would bring a rabbit in and just put it on completely the opposite side of the room. And then the next time, they'd put it a little bit closer, and then a little bit closer, and then a little bit closer. So you're sort of extinguishing the anxiety to the rabbit. Sometimes this is called flooding. And then a little bit closer, and then eventually the rabbit is put in the kid's lap, and he's happy petting it. It's because he's sort of extinguished that fear by having successive approximations in proximity to the object that produces the fear. And then you have aversion therapy, where if you have positive thoughts about something that's inappropriate, then you're taught to have negative feelings about that. Like, for example, in the example of alcohol abuse, this is a commonly used classical aversion therapy for that. You use a drug that's called antabuse, and when antabuse is mixed with alcohol, first, antabuse itself can produce nausea, and when it's mixed with alcohol, it really produces nausea. So the antabuse producing nausea is an unconditioned stimulus and an unconditioned response. You pair that with alcohol as the conditioned stimulus producing nausea, and the conditioned response of nausea is produced by just the alcohol. So you would learn through classical conditioning that alcohol produces nausea, a negative effect from what was an inappropriate positive stimulus, and then reduce alcoholism or reduce alcohol abuse using this technique. The same technique was used in Stanley Kubrick's film A Clockwork Orange, if you've seen that. What they did, they were these kids, and they would engage in very violent behavior and get lots of reinforcement from beating people up and doing other mean things to people. And so they produced a drug that produced nausea, and then they forced them to watch violent things on film while they were watching and having the effects of the drug. So violence as a conditioned stimulus produced nausea as a conditioned response. And they learned every time they would get into a situation where they started to be violent, then the classical conditioning would kick in and the violence would produce nausea. And it's kind of hard to have a fight while you're throwing up. It just doesn't work very well, and that was the theme of A Clockwork Orange. There are also therapies that are used by operant conditioning. And we're going to talk about three: behavior modification, token economies, and biofeedback. In behavior modification, you use reinforcement for desired behavior and ignoring or punishing undesired behavior. So it's just exactly what we talked about when we talked about reinforcement and punishment, negative reinforcement, positive reinforcement. We're using that to change behavior, in this case, change the abnormal behavior. In behavior modification, I want to talk about a study that was done in the late 80s by Lovas. She used 19 autistic 3-year-olds. Autism is a case where the kids are very withdrawn and not social, and they don't interact well with the environment. And she trained the parents to shape their behavior that were positive, like communicating, because they're not communicating well with other people. And they did that for 40 hours a week for a long period of time. So a lot of training working with the child, the parents working with the child in their communication skills. And by the first grade, 9 children were functioning well in school, just like normal kids, which is an amazing change, because if you look at a control group of 40 similar children that had autism, only 1 showed any improvement at all between age 3 and the age 6. By the way, behavior modification is the technique that's used here in Atlanta at the Marcus Autism Center. They have trained therapists that reinforce positive behaviors like communication. They negatively reinforce or punish negative behaviors, and that's the #1 used technique at the Marcus Center, which is one of the really well-known autism centers in the country here in Atlanta. Token economies. It tends to be used in institutions where and it uses secondary reinforcement, where patients get tokens for doing desired behaviors. And then they can use those tokens to buy things like treats or TV time or privileges in the institution. It works very well, and they collect the tokens and then they can buy things with them. And those tokens are only awarded when they do something that's desired by the therapist. And then I want to also talk about biofeedback. With biofeedback, you can measure something psychophysiology, and you can learn to control that psychophysiological response by receiving feedback about what's happening with that response. For example, if you measure muscle tension, and if muscle tension is reduced, muscle tension is one of the symptoms of anxiety, if it's reduced, the tone can sound, and your job is to keep the tone on continuously. So with the biofeedback about how relaxed your muscles are, that feedback that you get allows you to control it. A galvanic skin response, heart rate, breathing, muscle tension, all kinds of physiological responses that can be controlled by biofeedback, by giving that feedback to the patient. And then finally, I want to talk about observational learning, which is based on Bandura's learning theory. And the technique is modeling, where you simply have the patient observing people that are coping successfully with the situation that produces anxiety in the patient. Remember, Bandura's theory was that children learn things by watching other people do, watching parents, watching peers, and by watching and observing, you actually can learn the appropriate response. So here it's just used in therapy. So the patient watches how people successfully deal with the anxiety-producing stimulus, and that's good enough to cause changes in the patient. it's used a lot for treating phobias. I just want to show you one study that was done by Broswell and Kendall, which compared control groups, modeling group, and systematic desensitization group based on classical conditioning. And then you look at pretest, that is how many, these are phobias, how many approach responses you have to the anxiety object. In the control group, no change with time. In the modeling group, a significant change just by watching appropriate behaviors to that object. And with systematic desensitization, you get change, but not anywhere near the change that they found in the modeling condition. So observational learning is another way, especially with phobias. Thank you.